Hi, good morning everyone. So today I want to talk about antacids. Antacids are these pills that I think thousands of people around the world. And I'm going to talk about India today because, I've experienced almost every 1 in 3 people on antacids at any given point. And what I want to leave you with today is an understanding of how your stomach works and how antacids could actually destroy your health, make relief every time you have that acidity. Every time you have that, that acidic feeling, that burning sensation, that acid reflux, you pop that pill and it gives. Sorry, seem to be having a connectivity issue. Yeah, so I was saying every time you pop that pill, because you have that little acid reflux that comes up your esophagus or that burning sensation in your stomach, or you get bloated and you think, oh, I have indigestion, I have acidity. You think, you don't even know. And you reach out and you pop an antacid, which is available over the counter, or your doctor prescribed it to you at some given point in your life. You pop it, you get relief, and you get back to your unhealthy lifestyle without even understanding the trigger or the behavior behind the reason why you got acidic in the first place. So we think today, when I ask my general patients and my clients, like, why do you take an antacid? The first answer is, oh, it makes me feel better. I have acidity, I have bloating, I have flatulence, I have indigestion. Well, guess what? That's not fixing your problem. It's only making you feel better. And let me list out a couple of side effects of antacids and what it can lead to. Right from IBS to a leaky gut syndrome, to a Crohn's disease, to Alzheimer's, to poor indigestion. I have a whole list. Kidney stones, bone problems, osteoporosis, constipation, diarrhea. Yes. You didn't ask your doctor what the side effects of an antacid was, did you? Maybe the next time you should. Because I can understand when you take an antacid once in a way to reduce that acidic feeling that you have. I understand that some patients require to take antacids because they're on heavy treatments and heavy drugs for, which are unavoidable because of their illness or because of their disease or because of the treatment that they're going through. So yes, sometimes you have to take an antacid to balance out that effect. Perfectly fine. But for every other reason, taking an antacid can cause any one of those issues. And I'm going to explain to you exactly how. So because right now you might be thinking, Alzheimer's? How? Kidney problems? How? Malnutrition? How? Almost 1 in 3 Indians is suffering from malnutrition. And you'll be thinking, how? I eat 4 meals a day, I eat snacks, I have a vegetable juice. Because it's not about what you eat. It's about how much and how your body absorbs what you eat. And most people, they have compromised absorption in their intestines because of the amount of antacids that they take. So number one, the more antacids that you keep taking, guess what? It's dose dependent, which means your body starts getting used to it, and then you need a more powerful antacid, or you need more antacids to take. Many antacids contain aluminium in it, and aluminium toxicity in the body, which is created by taking a lot of antacids, directly causes Alzheimer's, kidney issues, and osteoporosis. Then there's a whole other group of antacids that contain magnesium. Now we all know that magnesium is needed by the body, but too much of magnesium also impacts your kidney. Too much of magnesium causes diarrhea. So now you have 2 sets of antacids. You don't know which one contains what, because we don't ask. We're not interested in knowing the side effects. Just because it's prescribed, we believe for it to be good for our health. So now your antacid creates constipation for you, or creates diarrhea for you. So you take another pill to fix constipation and to fix diarrhea, which was caused by the prolonged use of the antacids that you're taking. Number 3, antacids block the absorption of iron into your body, which in turn means we have low hemoglobin levels, we have low ferritin levels. So again, we make another trip to the doctor sees your blood reports and says, oh, you have low hemoglobin, you have low ferritin. Here, take an iron supplement. Do you need an iron supplement? Your antacids are blocking the absorption of the iron, which you're probably getting through your natural diet. Your vegetables, your fruits, your nuts, your seeds gives you enough of iron that you need. The only time we need more iron is when our body's not absorbing it the right way. So antacids blocks the absorption of iron and several other vitamins and minerals in the human body. So now you take an iron supplement, which causes toxicity to the liver. So all of a sudden you have a sluggish liver and you're unable to lose weight because your body can't burn fat when you have a sluggish liver. So then you get onto a diet plan, you increase your exercise, and you start getting more and more frustrated just because you have a sluggish liver, because you're taking an iron supplement that you don't need, because your body is not absorbing iron the right way. Forget about a sluggish liver. Prolonged use of that will make your liver a grade 1 fatty liver. Today, you don't have to be an alcoholic or you don't have to be eating junk food to have a fatty liver. I would say almost 40% of my Jain patients who are supposed to have clean diets have fatty livers because of the prolonged use of antacids and iron supplements. You got to keep your liver clean. It's one of the most important organs in the human body. So because of our antacids, we're blocking absorption of vitamins, and that's why we have falling hair, we have poor skin, and then we go to all these other various expert doctors who see the problem from their level of expertise. But if you really get down to the root cause of it, it is because of your prolonged use of antacids. Now let's understand how it works and why it's so bad for us. Your stomach needs to be acidic. Your stomach tries to maintain a pH level of 3, which is highly acidic, because you need an acidic stomach to break down the food that you eat. Carbohydrates, proteins, and fats need an acidic environment to break down. Then that pre-digested foods moves on into your pancreas and then into your intestines, which are slightly more alkaline to allow the assimilation of nutrients from the food that your stomach just digested into your blood and to your cells eventually. So from acidic, you move to alkaline, and that makes the particles of food or the nutrients, ready to be absorbed across your intestines, into your blood, and eventually reach your cells. Now, if you take an antacid, how does an antacid work? By neutralizing your stomach acid, which means your stomach no longer functions like a stomach. Your stomach functions like a chemical factory. You need acid to digest food. What is one of the side effects of all the acid medicines that we're taking? It's making us more acidic in nature because we're not allowing food to digest the right way. So now undigested food and larger particles of food reaches your small intestine. They tear a hole in your intestinal walls and gets into your blood. Any undigested food or larger particles of foods or protein molecules that passes through your intestine walls into your blood undigested, guess what happens? Your immune system flares up because your immune system now needs to attack those protein molecules or that undigested food. And we have IBS, we have a leaky gut syndrome because that thin fishing net kind of wall in our intestines gets bigger and bigger because of these large undigested particles of food seeping through and into your blood. So now all of a sudden you have an autoimmune disorder for which you take more drugs and you take more treatments, but all you need to do is correct your digestion, which has been compromised with the antacids that you keep taking. Antacids also disturbs your microflora. You have good bacteria and you have bad bacteria. Antacids wipes out your good bacteria and increases your bad bacteria, which is why you'll probably have more bloating, more flatulence, and less breakdown and assimilation of nutrients from the very healthy food that you think you're eating into your blood. Which is why you could be the healthiest person eating the healthiest meals, but you could still be sick and you could still be fat because it's not about what you're eating. It's about how your body is breaking down, assimilating, and absorbing. And antacids impacts your gut flora, your gut health, and your stomach health. So basically, again, your bones, how does it affect your bones? How does it affect your kidneys? Because you have either more magnesium or you have more aluminium toxicity in your body, and your food is not getting digested the right way, which means you are malnourished. You don't have the right nutrients that your cells and your body needs to keep you healthy. Your immunity gets compromised. And if you compromise your immunity, you're susceptible to anything, right from a mutation of a cancer cell to a germ, a pathogen, a virus, or anything else. So again, stop popping antacids like it's candy. Understand, make changes in your lifestyle. Acidity is one of the easiest things to reverse. And if you go back onto YouTube and you watch my acidity videos, and I think you'll find hundreds of people on my page who no longer take antacids and have reversed acidity. It gets down to your lifestyle, something that we all shy away from because we believe we can buy an antacid and pop it when whenever we feel acidic. Number one, chew your food. When you chew your food the right way, your food digestion starts in your mouth. We've gone over this 100 times, but it's worth repeating it again. Saliva, which contains enzymes that break down fat and carbohydrates, mix with your food. It softens your food. Your teeth breaks down food into smaller particles. When this reaches your stomach can work with the acid it already has to further digest it. If there are large particles of undigested food, your stomach has to produce more acid, increasing your own acidic levels in your stomach to break down the food that you've given it. Overeating and overconsumption of food, again, you make your stomach have to produce more acid automatically, which is why you probably feel that you need an antacid post-stat. The gaps between your meals, never leave a gap of more than 3.5 hours or 4 hours between any meal, because within 3.5 to 4 hours your stomach will produce acid, whether you have food in your stomach or not. And if you don't have food in your stomach, that's going to give you a feeling of acidity and bloating and indigestion, and all you need is food at that time, but you'll pop an antacid again. Then we have fruits. Your fruits have to be consumed on an empty stomach. Never mix fruits with your meal. Never have fruits post your meal. That'll make you more acidic. That'll make you bloat up more. Stress eating. If you eat under stress, your cortisol levels are already high. Your body is already acidic. You're going to produce more acid in your stomach, which may require you to have to take an antacid. And water. The art of drinking water. Drink water 30 minutes before your meal, then nothing during your meal. Most of the food that you eat is already cooked in water or has a high water content. So you do not need water. Psychologically and psychosomatically, your mind is probably used to having water in between. But I can promise you, you can eradicate your acidity, improve your digestion and assimilation of food if you respect the art of drinking water, which is stop drinking water 15 to 30 minutes before a meal, no water during your meal, and wait for at least 30 minutes post your meal to drink water. You do not want water to dilute your stomach acid, which has a job of breaking down your food. You want to respect the work that your stomach does. And so I actually made points today. Let me see if I've covered everything right now. Yep. So it's IBS, leaky gut, Crohn's, right to kidney problems, right to migraines, right to your skin, your hair, inability of losing weight, a sluggish liver, a grade 1 fatty liver. Yes, it just could be fixed by you taking care of your acidity the right way, by making lifestyle changes. Get rid of those stupid antacid drugs which just make you worse. Like I said, there are people who genuinely need it, but constantly speak to your doctor, because I know a lot of people who require it, but yet they don't take those antacid medicines because they make their diets more alkaline. They use lemon, they use cucumber, they use raw vegetables. They reduce the total amount of acidic foods when they're going through treatment, and most of them don't even know antacids. Also know that a lot of your painkillers that you're taking and a lot of the unnecessary medication that you take, like antibiotics, also create acidity in your stomach. The fifth point, remember that a lot of medication that you may have to be on, if they are acidic in nature, antacids will actually reduce their efficacy, because antacids will prevent the absorption of a lot of important medication that you may be on into your body, which is why we're totally against H2 blockers as well, because H2 blockers absorbs and reduces the efficacy of many medicines that you may be on right now to treat certain ailments that you have. So try to reduce acidity naturally. It's possible. I mean, the human body is designed never to be acidic, and if it gets acidic, it can automatically become alkaline. But when we overdo it, when we overconsume, when we have less sleep, when we have too much of stress and a sedentary lifestyle, it creates a breeding ground of, having an acidic body. And we should know that all cancers and most diseases, right from diabetes to cardiovascular problems to viruses, they all breed and they all survive better in an acidic environment. So make these lifestyle changes. Until next time, eat smart, move more, sleep right, and breathe deep. Have a good day, everyone.